Welcome to Healthcare Rounds. I'm John Marchica, CEO of Darwin Research Group. Thanks for listening. I'm super excited. New topic today. We're talking with Neal Shah, who has a really long resume of experiences. But today, we're going to be focusing a lot on insurance claims, insurance denials, and how it relates to his new book called Insured to Death: How Health Insurance Screws Over Americans and How We Take It Back. There you go. You're supposed to be like you see on CNN. You're supposed to have it like
in the
sitting behind you, Neal.
Just here you go,
propped up, so everybody can see it.
Yeah.
So anyway, he's also chair of Counterforce Health, and we could keep going, but I'm going to start off by asking you to talk about your background. But before we even get to that, Neal, thank you. Thanks so much for taking the time.
Yeah, John, thanks so much for having me.
All right, so we'll get into it. Just looking at your background, you transitioned from managing a $250 million investment fund to founding CareYaya and now Counterforce. Just talk a little bit about your background, then we're going to dive into your book and the insurance things. But talk about your journey and where you've come from and what led you to even be doing the work that you're doing now in fighting the good fight with insurance.
Yeah, sure. I basically kind of had a midlife crisis in my mid-30s, after a successful career in finance. And it was really catalyzed by personal experiences with care, But, quick summary is throughout my 20s and 30s, was a rising star in the hedge fund industry, became a partner at a multi-billion-dollar fund when I was 27, managed the portfolio really well through the 2008-2009 downturn and recovery, and generated very high returns. So one of the investors backed me to start my own fund, which I grew, from the time I was 31 from 10 million to 250 million by 35. But really, I suddenly became a caregiver, and that really shifted the course and trajectory of my life. I went through multiple years of care for my grandfather through dementia, kidney failure, cancer, and end-of-life care, where I was the one in the family care coordinating and managing everything. And really, my mom was directly doing it. And I realized how broken care is, whenever someone in your family or a loved one gets seriously ill, just all the burden it puts on the family. So at that point, I was still running my fund, and I became very obsessed with the care economy and the care industry. And I was finding ways to invest in it. I just anticipated that this would become a growing problem in our society. And then at the peak of my fund, my wife became severely ill and went through years of cancer, during which I kept taking sabbaticals from my fund to manage her care. And then ultimately just made a difficult decision to wind down my fund and become her full-time caregiver. So it was really eye-opening of how difficult it is when someone in your family and a loved one gets severely ill. Thankfully in that case, knock on wood, due to my full-time care, my wife ultimately had a successful outcome and has now been in remission for a few years. And at that point, I was just I became less interested in finance and became very obsessed with solving real problems that families and caregivers and patients across America are facing. I think we have an amazing healthcare system in terms of amazing therapeutics, amazing, equipment, amazing hospitals, but we also have a really broken kind of social care, home care, care navigation, care finance. These are things that a lot of patients, family caregivers find very difficult to navigate. So just became obsessed with okay, I'm going to make this my life's work to see what I can do to improve care.
It's the way a lot of companies get started, right?
Yeah.
And a lot of books get written from that passion point, right?
Yeah.
When you experience something that is so personal to you, and I can just imagine, you're leading the successful life, by any measure, and you're all of a sudden your wife gets ill, and then going through all the machinations. And look, I bet a lot of people listening to this, I know a lot of physicians and a lot of healthcare leaders listen to this and they get it. Yeah. But a lot of times they get it sort of conceptually or intellectually. Yeah. But until you've personally gone through it, especially, I haven't had to deal with it with a spouse, but I certainly had to with my parents. Yeah. So we don't need to get into that.
Yeah, it makes it real. It makes it real. It's not intellectual anymore. Then you're living it. And
so I'm curious, was there a time, usually there's a spark, right? Mm-hmm. Was there a time when you were dealing with helping your wife and care management, really just ticked you to the point of absolute insane frustration? Talk a little bit about, was there a tipping point for you that really spurred you in this direction?
Yeah, frankly, thanks for the question. some of the hardest times in her cancer battle wasn't fighting the disease. It was fighting the health insurance companies. It was unbelievably infuriating. There were so many denials of bills, denials of treatments, uncertainty about whether or not she would be able to get a certain therapy. It was just infuriating. We wasted dozens and dozens of hours on the phone, so many hours doing research. I mean, I think that literally, it's not a hyperbole. I think fighting health insurance companies during these times of major illness is exhausting, infuriating. It adds a lot of stress. And I think that was probably one of the big kind of catalytic points of saying, okay, got to do something about this. I mean, I can go into detail, but I mean, there were several times of just like all out war against the insurance companies. And by the way, for us, these were situations where I had accumulated a bunch of savings due to my career, and as had my wife. So in some of these battles, we would just give up at some point and just pay out of pocket. And that was fine. But I think what infuriated me the most was I was in so many caregiver support groups and cancer support groups, really leaning on other people helping me helping them. And I think the most infuriating was other people were going through this and many people did not have those means and they were foregoing essential treatments. And I think that is heartbreaking. And that's, in the wealthiest country in the world, I think it's sad that this is how healthcare is delivered, when you're going through a major crisis in your life.
And Neal, don't you think, that's more the norm, right? That's more the average person who, oh, geez, I got another fighting this bill. All right, it's 10 grand. All right, I'll pay it. That's not the average person.
Yeah.
10 grand is 5 grand is whatever. Those large sums that you see coming in can be, truly life changing, right?
The average person does not have more than $400 set aside for an emergency medical expense. So when you say, oh, it's $1,000, critical cancer drug denied. Yeah. Most people are not like, okay, I'm going to out of pocket this one. They're going to say, I'm going to go without it. I'm going to go without it, or I'm going to try to fight for a month or two, and then during which tumors are going to grow. So yeah, I think that's probably the most frustrating thing. I think my own frustration was more of a financial frustration and a time waste and a stress frustration. But I think the frustration of others that I was close to in caregiver support groups became deeply kind of internalized. And it was like something where I had a mental note of okay, I'm going to do something about this at some point.
Well, and I had a note here, some dying to read your book. And I know I have one coming, but that you pointed out that over 99% of denied claims aren't even appealed.
Nope.
Patients
don't know their rights. Patients don't know their rights, and the providers are too busy. I think that the economics of claims. In aggregate in America last year, 5 billion health insurance claims went through, of which 850 million were denied. So it's approaching 20%. By the way, that statistic 15 years ago was less than 2%. So this scale of claim denials is a modern phenomenon, that wasn't as prevalent in 2015, 2010. So health insurance has been around for decades, but the claim denial problem is really a last 5 to 10 years problem in magnitude. They've gone up 10x. And to your point, most patients don't know their rights. It's too intimidating of a process. They don't know they can appeal. They don't know, how do I do robust enough research to push back? I don't have a brother or sister or a mom or dad who's a doctor who can sit with me for a few hours. So I don't know how to fix billing code errors. I don't know how to prove medical necessity. So most people just kind of tap out and say, okay, I guess I'm not going to get this. So I think that is a really damning statistic, that 99% of people don't appeal. And of the 1% of people that do appeal, 40% win at baseline. So that tells you, one, that the denial of claims is frivolous, right? It's just like a frivolous barrier they're doing to see if you'll bother to take action. And two, if you can make it as easy and one click as possible for people to do it, more people would do it. And then more people, would win at that 40%. And then three, if you can make it better to, ease their research process and create a much more robust quality appeal, more people would win. So I think that, these tools are at people's disposal, but the system is purposefully obfuscated to, just kind of capitalize on people not pushing back.
So Neal, when I'm thinking about the time frame in all of this, as a healthcare researcher, services researcher, I think back to the managed care days of the 90s and the 80s and 90s, and even into the 2000s, when the motto was like deny, deny, deny everything.
Yeah.
Right. So there's that in the history.
Yeah.
Then as we move forward into this value-based care world, right?
Yeah.
At least there's this sense that healthcare today is not being driven as much by denials. Okay. Now, back to you, what you said.
Yeah.
What is driving that rapid increase in these, as you say, frivolous? And look, I'd have to agree with you. I'm not taking any side on this, but if that many people get relief, 40%, I think what you said, get relief just by pushing back, that just screams that it's frivolous.
Exactly.
So what's behind the push? Why has it escalated so much?
Magic word of the day: AI. I think that insurers, as with any new technology, when you study kind of history of new technology, usually kind of the most powerful and most resource interest will adopt that new technology fast, usually against, kind of the people they're fighting. And then over time, the technology will be more distributed across society. So I think that AI has been massively adopted by insurers. AI, and prior to modern AI, you'd call algorithms, right? Data science, machine learning. But over the last 5+ years, the large insurers have started programmatic denials, which take very little time, very little to no human oversight, which is kind of critical from a liability perspective, because when you get caught, you just say, oh, AI system has an error, right? And there have been multiple investigations here busting the insurers on this, right? Like the Stat News guys won a Pulitzer Prize on United Health's algorithm that was a 90% denial rate of older adults in skilled nursing and assisted living facilities, because the algorithm is trying to figure out who's least likely to push back and then just deny them all. So that's something where you can say, oh, I got busted. Oh, it's an algorithm problem. No one's accountable, right? Cigna had the CXDX algorithm I wrote about in my book, 300,000 denials, average 1 second. So, it's kind of like, if there's an error in the algorithm, you can blame the algorithm, but there's no accountability. And the algorithm's allowed, it's kind of, I do believe there's good intention people who work at these insurance companies, but there's things that an algorithm can do because there's no morals that even a human, you can't possibly get them to do over and over. Otherwise, they'll just quit. So I think it's really the adoption of AI by insurers has skyrocketed the denials. And if you think about it from a patient and provider perspective, it has flooded people with administrative BS that people cannot do. So if one side is AIing this, and in less than a second, some algorithm that costs pennies denies you, and you as a patient have to spend hours learning, researching, writing an appeal, you don't have a chance, right? Like you're using a knife to fight somebody with a gun. And from a physician's perspective, whether it's a large hospital system or an independent physician, the American Hospital Association has a stat of each appeal cost providers $46 on average, right? Of just like administrative time, doctor time, et cetera. So if you have a $46 of manual time versus an algorithm that costs somebody pennies, of course, they're going to use it like crazy, and you're going to lose because you'll never fight back, or you'll be calculating when to fight back. So I think it's really, they have weaponized AI technology, and there hasn't been AI built for the other side, which I kind of realized while researching and writing the book. And really it catalyzed our movement to build Counterforce Health, because we were we need to build AI tools to arm the resistance.
So before we get into the book, tell me about Counterforce. Tell me about specifically what the organization is. Is it fighting AI with AI?
Yeah, sadly, yes. Yes.
Tell me more about the organization.
Yeah. It's patient and provider focused AI. So AI tools to help people manage and appeal denials rapidly. So initially we built it for patients. I think you alluded to my work in caregiving and helping people caring for older adults with dementia and with cancer. So we built it initially to relieve the burden on patients as well as their family caregivers. And there was such rapid usage and adoption, and eventually clinical usage. A bunch of clinics started using it. Small rural hospitals reached out. They wanted us to customize it for them. So then we started building provider side tools as well. But they're completely free to use. We're entirely grant funded through NIH and University of Pennsylvania. And we're helping tons of people. It's been a really cool and fun project, probably the most socially impactful project I've ever done in my life. And really interesting to see how quickly, in less than now 9 months, we've gone from basic prototypes to widespread usage and achieving pretty good win rates. So the way the tools work is anyone can come to the site and just create a free account, just enter your email address, and then use the tool. People can upload their policy coverage document. denial letter, any kind of background healthcare information. The more information you upload, the more robust the appeal will be. And then within a couple of minutes, it'll kind of like parse through all that, even if it's scanned, optical character recognition models, et cetera. We'll parse through it. We've trained it on billing code databases, so it can fix billing code errors. Approximately 24% of denials are due to incorrect billing code. For medical necessity, those are obviously much more qualitative and subjective appeals. So it'll cite research journals and figure out kind of like the most appropriate citations for you and link them all so you can kind of verify. And it basically takes that 6-8 hours of detailed research down to less than 2 minutes. And then you, as a person submitting an appeal, whether you're the patient or provider, you just become the editor. You don't have to be the researcher and writer. You just get the thing done for you in a couple of minutes. And now you can just sit there and read, click through and decide, okay, do I want to modify anything or do I want to just print this and submit? So it really eases your burden.
Wow. So you're not actually, or maybe there's a business in there, you're not actually fighting these claims for people, but you're arming them with the, helping them sift through the bureaucratic nonsense and all the paperwork to empower them to address these claims.
Yes.
What kind of reactions? I'm sure you've talked to a lot of people, but I'm curious to know people who've used the service and use it. What are some of the things that you've hearing? Yeah, any success stories that you can share?
Tons. We've had a couple of really viral news coverage. Like actually just yesterday, we had a CBS News nationally covered the story where there was a social worker who's actually an oncology social worker. This is a very interesting story. She's an oncology social worker at a major hospital in California. But for her own baby's birth, her baby son ended up having to be in the NICU for a few weeks after delivery. She ended up getting $8,000 of bills, which were kind of unexpected, and they were supposed to be covered under her health plan. She spent a couple of years fighting him and was on the verge of tapping out. Her husband was saying, let's just pay it. We don't want to get this on our credit, et cetera. And then she found our tool, and literally within a couple of days of like not only using it, and I forgot to mention this, she didn't just use it to write detailed letters. We actually have a voice AI agent that people can call and talk to and have it retrieve a bunch of data. So she actually had this super long voice conversation just over a landline phone. And a lot of people actually like this. We found voice interfaces are much more user-friendly than typing stuff. So they'll just talk on the phone about all the details of what they went through. And between the letter writing and the voice AI, it informed her there was a law passed in the late 1990s where this type of a NICU admission is covered under mother's insurance. And as soon as she learned that, and then she appealed back, suddenly they dropped it. So it was a cool story because a lot of people could relate to it. But CBS News featured the story nationally and then put it on their TikTok and Instagram. And it's literally, this came out yesterday and it's gone absolutely viral. There have been like millions of views online. And we've had a couple of things like that. Like interestingly, we were building this for a while and a lot of people are using it. But in the last month, the story has gone viral. Where like NBC National has covered it. ABC Regional here in the Southeast US covered it. And then those stories end up going viral online because the stories of individual people are really interesting. Like forget our tool. Like it's use anything. I don't even care. But people need to fight back. But I think what's interesting is real people can relate to this of like, here's a mother who's working in the healthcare system, fighting a massive bill over her son's delivery, and she doesn't really know all her rights. So imagine if they paid that. That would have been an $8,000 total waste. It would have been actually illegal for the insurer to collect that. And they backed off, when she made that threat. And there have been tons of stories like that. We've had people denied critical cancer care in the middle of cancer treatment after being on a certain drug for a year. They're suddenly denied the care. I mean, these are just like both heartbreaking and infuriating stories, because we're sitting on the other side seeing it. And they'll be like, okay, this is my third month that I went without the meds while they're trying to figure out how do I appeal. And you can see the notes, from their physicians. It's like, well, tumors are growing now. It's like we had this under control. And you're like, really? This is sometimes it's over like $400 or $500 too. It's not always in the thousands of dollars. So these are just really, really sad stories. But we've had a bunch of wins. And I think that's been really awesome to highlight and feature because it empowers other people, anyone else in that situation to be like, oh, maybe I should take some action and appeal.
Well, and that's where you have the actual doing, right? So you're assisting in this process.
Yeah.
Different from that is, well, let's get to the book.
Yeah.
What was we talked a little bit about the motivation, the personal experience and all of that. But But how do I frame this? What can the book do for you and your mission?
Yeah.
Versus what, the tools and all of that.
Sure.
How have you separated that out?
Yeah.
And what are your primary goals with having the book out there?
Yeah. I mean, I'd say the primary goal is in the subtitle, Insured to Death, How Health Insurance Screws Over Americans and How We Take It Back. The primary goal through the book is really advocacy. And of course, you can see the attention-grabbing title where it's a denial letter and the shadow is a gun. And I believe this is what's being done to patients and providers. The real goal of the book was, I'd say, twofold. One, on the patient side, to empower people to know their rights, whether or not they use our tool or use ChatGPT or use anything. It's just know that you have multiple appeals directly with the insurer. Know that you have what's called external review. You can go to the state insurance commissioner and figure out a process depending on where you live to externally appeal, and they will have to appoint independent third parties to adjudicate that. Know that you have legal rights if you want to escalate it even further. So I wanted people to know that they have all these methods at their disposal. And really people to think and push back on their representatives of why is this happening? And should we have a dialogue, in terms of in policy about this? But equally importantly, a big audience for the book is physicians. I think physicians across America are getting absolutely screwed on this. And this is literally creating an insane amount of what's called moral injury, in medicine, where a lot of people go into clinical practice wanting to treat and heal people, and they're being stymied and dictated by the health insurance companies what they can and can't do. And I think, they didn't go into these careers to be a lawyer, to sit there hours and hours arguing on the phone, writing a bunch of paperwork, and sometimes that burden becomes overwhelming. Many people don't have time. So I think in the book, I really wanted to document all these cases of what are people on the ground saying, people that we talk to, people that use our tools, as well as people I just proactively reach out to, whether it's at big hospitals. I actually think one of the biggest insights from the book was the death of the independent physician. A lot of, people who are running, one or two physician neurology practices, rheumatology practices, I think those people are just like drowning in this administrative burden because they don't have the tools that maybe a large hospital does, where there might be an entire team focusing on billing and claim management. A lot of times their admin or billing person is handling all this, and it becomes a big revenue cycle issue for them. So I think that, the hypothesis of the book is basically this extreme levels of denials of claims is harming both patients and providers, and it's going to lead to an eventual collapse of our healthcare system. So something needs to be done from a policy perspective. And, I propose my ideas, but I'm also open to other people's ideas. So whether it's, penalizing. Oh, go ahead.
I'm sorry. I was just going to say, well, what do you want to see happen? Like if it were up to you, what are the next steps? Because it's one thing, and before you answer the question, I'm sure you've heard this excuse or this comment before where insurance companies say, well, somebody has to be the arbiter. And it doesn't matter if it's the government, if it's we're private company or publicly traded company, somebody has to be the arbiter. And we get a bad rap because we're the ones that have to say no. So
that's a convenient, convenient for the
It's very convenient, right?
But here's what I would say. Look at Singapore, and not to, I have my own policy suggestions and proposals, but I'm open to other people's too. But I actually think direct care is a very viable model. So the way Singapore funds its healthcare, is actually fascinating. And I wrote an op-ed in US News about this a couple of weeks ago, where the US is spending about 18% of GDP on healthcare, and Singapore is spending 4.8% of GDP on healthcare. Singapore actually has much better outcomes. US has some of the worst outcomes compared to how much it spends. Singapore has better outcomes in life expectancy, lower rates of chronic diseases, et cetera. And it's a pretty kind of self-directed market. So the way that market works is everybody gets a certain amount of tax deferred that they can put into their HSA. And it's quite high level. If you are lower income or you're elderly, the government will fund that into HSA. Then everybody using those accounts pays into catastrophic coverage policy in case a major disaster happens. That thing backs you up, and that's provided by private insurers or public insurers. So there's kind of a very robust free market, but the vast majority of care is just paid through your savings accounts out of pocket, and you've accumulated enough into your HSA, and then when you need care, you spend out of it. As a result of that, the cost is way, way lower. So I think that this is where I disagree with the insurers. You don't need a middleman. think about what doctors were doing 50 years ago before the rise of insurers. You just directly went to your doctor and got something done. In many other parts of the world, many parts of Asia, poor countries as well as rich countries, and even some parts of Europe, there's just a direct care model. And you're seeing in the US a rise of this. Much more people are relying on HSAs. A lot of doctors are going kind of direct, whether it's direct primary care or direct concierge care and other specialties. But I believe that significantly reducing the role and the power of the health insurers across the entire ecosystem is going to be a win-win-win for society. It's going to be a loss for them, but it's going to be a win in terms of way lower healthcare spending. It's going to be a win for way more physician autonomy. And it's going to be a win for way more or way less administrative headache on patients. So I think the insurers have become too large and control the healthcare system. And then that's why the healthcare system sucks.
There's a lot of reasons why, right?
Yeah.
but if you were to say, and we've got to wrap this up in just in a few minutes, but and rather than the extended policy prescriptions, if there's one thing that you could do, that you could introduce at a policy level, without, because we've seen what's happened with healthcare reform, with the Clintons, and then Obamacare, and all this stuff is a nightmare, right? In DC, what would be the one thing that you think that you'd get the most, as the saying goes, the most juice from the squeeze? What would be the highest impact one thing that you think that you could do tomorrow, or within the next, years?
Okay, great idea. Get rid of the tax subsidy for employers contributing health insurance, and do unlimited HSA contributions, and use the $230 billion that you saved on that tax subsidy to fund HSAs for lower income people. So shift everything to HSAs and just let people choose.
And who would fight you on that tax deduction?
Oh, the entire insurance lobby. I actually think the employers wouldn't even mind. And the employers are getting, kind of annoyed with this too. But I think the insurance lobby might fight tooth and nail on that. But you know what? Who cares? I think that the public opinion, you can see where the public opinion is right now, and I think they've tried to suppress public opinion, but, it's pretty solidly against them. And I think they kind of went over their skis in terms of bad behavior.
I know that you'd be fighting that battle uphill, but ironically, it's kind of like some of the things that are being done or talked about, at least PBM reforms and the pharma side of things.
Yeah.
It's one of those things that could be bipartisan, that most people could kind of understand. Maybe there's a little bit of a pushback on, like, if employers aren't offering that health insurance or aren't as incentivized to offer that because they're not getting a tax break for it. There might be some of that, but that might be more doable than you think. Yeah,
I think so, especially around HSAs, because I think the bipartisan thing there is, I think a lot of the right wants to push much more HSAs and flexibility in spending and consumer choice. So why isn't there more tax break being given to people who want to contribute to HSA? And you could redirect some of that employer contribution to Insured, to employer contribution to your HSA, for example. And I think on the left, people just want to make sure there's a safety net for people. And currently, insurance is not providing that safety net, right? 2/3 of bankruptcies in America last year, personal bankruptcies, were due to medical debt. And 83% of those were people who were insured. So insurance doesn't mean anything. So I think you could see a bipartisan alignment. And I would say, look, the biggest thing is we don't need to let this go on so that there's more Luigi Mangionis, right? I think that should have been the call to action for society, not just the event itself, but the public reaction, I think, showed what many individuals feel but aren't saying. And then I think they felt kind of open to saying it. But I think that should have been a political message that the system is so broken. And I think if we allow the current system to perpetuate, there will be more events like that. And we don't need that. I don't think that's in a civil society, you should have stuff like that. But I think that should be a sign for the system to change. And I think a call to reform.
Yeah, I mean, we could talk about this forever. Yeah. I am going to ask in advance. I'm going to want to have you back because there are other topics that in my list of things, just because you've done so many things.
Thanks.
Other topics that I want to talk about. Yeah. But for the next minute or so, we're going to do a little lightning round. I just have a few questions.
Yeah.
And just give me, your best answer in a short form.
Okay.
It took me longer to describe what a rapid fire question is than to actually ask the rapid fire question.
Okay.
So I'm just going to get into it.
Sure.
What's one health policy change you'd enact immediately if you had the power?
No limits on HSA contributions. Sorry, not to be the dead horse. And I don't run an HSA company, by the way. So I'm just like throwing a freebie to the industry, but I really just like want to go to more choice. Yeah.
And I'm sorry, I'm ruining the spirit of the lightning round, but I wanted to say this before. Most of these accounts, and I don't know enough about what the law is or what's the maximum and all of that, but it's like it covers your contacts, it covers your glasses and maybe co-pays on certain things, but it doesn't. It's such a low amount, I think, for a lot of people that it doesn't really raise doesn't really reach my radar. Certainly. But if I were to put a substantial amount in there, then I would have more choice around where I would go for services. Right?
Agreed. Well, and you change your behavior. See, even if you have a few thousand in HSA, you don't, because you have insurance, when you go for a procedure and they say, this is what insurance is going to cover and this is going to be out of pocket, most people don't even bother to shop and ask, what if I paid direct? How much would it be? And many times when people do that, they're surprised. Wait, the direct price is lower than what I pay out of pocket on the insured price? Doesn't even make sense. So I think a lot of it is like shifting consumer behavior. Let's say if you have a quote unquote on paper a $5,000 thing that with insurance is going to cost you $1,200, and you say, okay, I'll just pay direct, and they're like, all right, $800. And you're like, but most people didn't even bother to ask that. So I think that part of it is like allowing this so that consumer shifts, the way they purchase healthcare. And I think that also creates think about when you go to the grocery store, right? Like you comparison shop and you price and you think. I actually think that, I really believe in I believe in free markets, right? I'm just generally a capitalist by background. And I think this is the least free market that there is, So, it's a market with massive amount of price opacity combined with a handful of players controlling the market. So no wonder it's 20% of the US economy. And it's probably the worst industry in the economy in terms of inefficiency. So I think that by creating almost like a consumer choice, free market, price signals, you shop for your own healthcare, I think that you'll do wonders in people's choices. And then you just have to make sure there's a safety net. But I think there's an illusion that there currently is a safety net, which there isn't. Sorry, that was not rapid fire.
No, that's all right. That's fine. All right, we're back to the lightning round now. Okay. A care innovation you believe is underrated today?
Man, that's a really tough. Okay, underrated care innovation, I think, is voice AI technology. We have built some of this for insurance denials, but I've seen other people building this too. And what is really cool about voice AI technology is that a lot of us, living in big cities and we're younger, we fail to appreciate, and a lot of my work involves around helping older adults. Did you know 42% of people above 65 in this country don't have broadband internet? So voice through landline, in my opinion, is the best form factor for bringing the power of AI technology to the mass, especially the rural, lower income, older adult population, which stands the most to benefit from this technology, whether it's through navigation of resources in their community, whether it's through navigation of health issues. Hey, what should I do? XYZ happened to me. A lot of healthcare, rural hospital systems have been shut down. So I think I love anyone trying to do voice AI to check in on older people, to help guide them to things, because they're not going to be downloading new apps. Many of them aren't even going to be able to access high-speed internet, but you can, on your end, with a decent system, you can dial into somebody's landline and then have them, through conversation, experience all the benefits of AI. And I think that's kind of I see a lot of care innovations happening in that realm, and I'm very excited about each one.
Cool. All right. Still in the lightning round, Neal, just going to remind you, biggest misconception people have about health insurance in the U.S. Biggest misconception.
That health insurance is health care. That in case of a catastrophic emergency, you're going to be covered. No, it's sadly, I've lived through it. In case of catastrophic emergency, you're going to be bankrupt unless you have a bunch of savings, and that's a big misconception.
Very true. Yeah. One lesson from finance and from your earlier life that informs you today in your mission against these insurance denials. What's one lesson that you learned from that world and brought it into this world?
Good question. I guess say maybe one lesson was don't go for maximization of profit margin, that there are viable ways to build very scale businesses that are very razor thin margin, but just helping and impacting a lot of people. And I think that sometimes is counterintuitive in a lot of work I've done around caregiving, elder care, around even like insurance analysis, that oftentimes entrepreneurs start in these industries and have a target percent profit margin in mind. But I think they're kind of missing the forest for the trees, that these markets are so large that if you scale a razor thin margin solution that's helping tons of people, you have opportunities to build Costco or Amazon like business models. And healthcare is so large that business models like that can really proliferate. And I think the biggest observation, like look at open evidence, that thing is like grown like crazy, and it's like razor thin margins. And a lot of people are like laughing at it and, kind of saying, oh, this doesn't make sense, whatever. But it's like, look how big the market is, like you don't need to profit maximize, when you enter markets like that, if you have a cool new thing and you're earning a razor thin margin on a lot of volume. So yeah, that's been an interesting lesson from finance.
Last question.
Sure.
When you were going through caring for your wife, what was the one thing that kept you sane during those difficult times?
Caregiver support. I'd say nothing related to healthcare. I was pretty active in cancer support groups and leaning on the help of other people going through it like me, and people that have been through the journey successfully, people that had been through the journey not successfully, and other people at the same stage of the journey as me. I think that is really underappreciated in healthcare. Like just kind of, you have a new thing. At that time I was 35, never been through anything like that in my life, and it was like extremely emotionally taxing, physically taxing too. And it was just probably the most helpful thing was just talking to other people, talking to other people who have gone through similar experiences.
Right. Well, Neal Shah, thank you. I appreciate, I feel like we've scratched the surface.
Yeah.
Again, I've already asked you, I'm going to want to have you back and talk about some other topics.
Would love to.
How do people reach you if they want to get a hold of you?
Yeah, sure. I'm pretty active on LinkedIn. So Neal, Neal, middle initial K, and then last name Shah. So feel free to hit me up there. And then as well as I have recently, at the urging of my team, become more active on TikTok and Instagram. So I'm like, my wife's laughing at me, like I'm mid 40s now, but I realize this is the way to reach people. So I'm active on there as well. But yeah, LinkedIn is probably the preferred way. And then of course, check out our site. We'd love to help anyone, whether it's a patient or a physician or a rural hospital, anyone that's interested in fighting denied claims, reach out to us, counterforcehealth.org.
Awesome. Neal, thanks again. Really appreciate it.
Thanks, John. Really appreciate the opportunity.
Well, that'll do it for another episode of Healthcare Rounds. I'm John Marchica, CEO of Darwin Research Group. Listen, if you like what you heard, please make sure to rate and review our Healthcare Rounds. And see you next round.